Thank you so much for your motivation, ma'am. Now we'll start with our session. And it's a privilege to have Dr. Jamna Rani, ma'am, HOD, Professor of Pathology, Bharat Medical College. And also she's a guiding light and mentor. We'll start with the session. It will be a question answer session. Ma'am, the first question to you is, what inspired you to choose pathology as your career?
Okay. To be very frank, when I read pathology in second year, so I read it like any other subject only. Okay. And in second year, the toughest part in pathology is identifying all those slides. Just like any other student, we used to identify the air bubble and the crack in the slide, and that is how we learned our second year of pathology. So the importance of pathology, I realized it when I was doing internship. All the therapeutic decisions, all the diagnostic decisions were based on pathology. So, I had a liking towards pathology, I would say, when I was doing my residency. But once I cracked my postgraduate examination, so I felt, I was really thinking about the work-life balance and all those aspects. So to be frank, why I chose pathology is I felt I can have a perfect professional as well as a personal satisfaction as a pathologist. So that basically inspired me at that point of my life and career, and that's why I chose pathology.
Okay, ma'am. And what is the one thing you think that sets pathology apart from all other subjects in medicine?
Okay.
What do you find so interesting in pathology?
Yeah. See, I always tell people, pathology is one specialty where you interact with every clinical specialties. When you take medicine and allied without our CBC or clinical pathology or the coagulation aspects, no medicine department can, they are totally, all those investigations in pathology. So that is very vital for making clinical diagnosis. Similarly, surgical, I don't even have to say, without surgical pathology, without histopathology and diagnostics, cytopathology, frozen section, and all those. So all the therapeutic decisions across all the clinical specialties, the only department, the only subject where you interact with all the clinical departments. So the entire clinical departments will be dependent on in any way or another with pathology. So we have the privilege to interact with any clinician. Every clinician of the hospital is dependent on pathology reports. So I think that is the uniqueness of pathology.
Okay, ma'am. Nowadays, selecting an institution has turned out to be very important in choosing a PG in post MBBS, ma'am. So, what are the factors do you think you should consider before choosing pathology in a college, ma'am? What are the factors that are required for an institution?
Okay. See, first and foremost, pathology. See, if you want to be a pathologist, first thing is you should be really dedicated, because pathology diagnosis is the backbone, and all the diagnosis, all the therapeutic decisions, everything will be based on the pathologist report. So my professor used to say, the histopathology report, whenever we make a diagnosis, so it is my professor who taught me pathology always says this thing. So a pathology report, whenever a pathologist is writing a report, it is like a court judge writing a verdict, which cannot be changed. If a person is having a cancer, see, that is going to totally change his life. So we cannot afford to make any mistake. So he always, whenever he teaches us pathology, he always says this to us, that you should be really careful whenever you are making diagnosis. Each and every report, you have to be very, very cautious. You have to double check, triple check, and you have to be clearly sure whenever you are signing out any of the reports. So in the era of evidence-based medicine, where there are legal consequences for each and everything, choosing pathology as a career. First of all, whoever wants to take up pathology should have a keen interest, because the future of diagnostics, the future of medicine will be pathology. So please keep that in mind. Or unless you have a specific passion. See, gone are those days. See, I told you how I chose a pathology. I really thought. So I was very, that was my frank thought that time, that I thought I can have a perfect work-life balance. So that was my simple thought. But when I joined, I realized, no, it is not like that. We have to really work very, very hard. So whenever residents who wants to take up pathology, you have to have a clean passion for the subject, clean passion for the diagnostics, be ready to work hard. You have to read almost every subject. Pediatric pathology is a separate domain. Hematology, clean, there are multiple disciplines in pathology. So you have to really work very hard and study. So when you come to choosing the facilities, first of all, the institution where you're planning to pursue your pathology degree should have adequate clinical material, because the clinical material alone will fetch more diagnostic material. So it should have adequate clinical material, and the surgery load, especially the oncology surgery load, should be definitely high. So the department, the institution which you are choosing should have active super specialty departments, especially super specialty surgical departments. And again, in medicine, if there are cardiology, nephrology, if there are super specialty departments, definitely, if they are actively doing well in super specialty, definitely that institution will be a good place to pursue your pathology degree.
Okay, ma'am. What is the significance of having a huge patient load and diversity for pathology, ma'am? A patient load and diversity in the hospital clinical side, and how much significant is that for pathology department?
Definitely, when you have more clinical load, then more investigations will be done, and more the number of here we are not talking about. See, we are in the era of automation. So here we are not talking about the basic investigations like complete blood count or urine analysis. So what we are focusing for a pathology residents is, so minimum the pathology postgraduate should have exposure to at least 5 to 6 bone marrows per day in hematology, and definitely 3 to 4 leukemia cases, CML or CLL or AML or ALL. So they should gain the expertise in that. And only if there is a proper oncology department, diagnosis will be made there. So they have to have access to flow cytometry and chromosomal karyotyping. So all those things. So only if there is a good clinical load, and only if there are treatment options based on pathology is decided. So if there is a radiotherapy or a chemotherapy unit, definitely flow cytometry will be there, immunohistochemistry will be there, frozen section will be there. So if the clinical departments are functioning well, it indirectly implies that the diagnostic departments, not only pathology, all the departments will definitely function in a more effective way. So with the clinical data, you will definitely have a idea on how the diagnostic departments work. So the more in-depth investigations, in the sense, so that depends on the super specialty departments. So more super specialty departments functioning well, it means default, you can imply that the diagnostic departments will be doing great.
Okay, ma'am. As a pathology PG, what would your typical day look like during your residency life?
Okay. So for a postgraduate, the day usually, see, even in our days, we usually start at 7 a.m. in the morning, and night, even there are days where we used to stay till 9 o'clock, 10 o'clock in the pathology laboratory itself. So what we do is the histopathology slides, hematology slides, all those slides will be prepared. And next day morning around 9 o'clock, it will be submitted to the faculties for making a diagnosis. But we reach the department in the morning, we have to screen all the slides, whatever be. So, for example, in a place where I studied, definitely there will be around 75 general pathology samples will be there, or 55 gynec pathology will be there. Then we'll have medico-legal cases. After autopsy, they'll send the specimen to us. So MLCs will be there, paying patients will be there, samples from PHCs will be there. So daily load will be around 300 tissue specimens. So on an average, if 300 tissue specimens getting converted into slides, so definitely we have to screen 1,000 slides per day. So what we do is, evening first set will come. After 4 o'clock, the first set of slides will come. So we will go, we'll take a break, we'll refresh ourselves, we'll come back to the department at around 5 p.m. in the evening. We'll start screening the slides. Next day morning also, we'll screen the slides. See, unless you see the slide before the faculty sees, you will not learn anything. So you have to see the slide, you have to make your diagnosis and you submit it. Then when the faculty makes, we will recheck it. So only if we work like that, we will be able to excel. So we will screen all the slides before 9 o'clock and write our diagnosis and we will submit it. After which hematology PGs will go there. They will examine the patient. See, pathology in the new NMC guidelines, if you check in pre and paraclinical departments, pathology will not be there. So with the current guidelines, pathology has already moved to a clinical specialty. So as pathologists, unless you have a proper clinical diagnosis, making a pathology diagnosis is very tricky, very difficult. The simple example which I always say is, suppose you take a bone biopsy from a person with the fracture. It will exactly look like a osteosarcoma. So the clinical history is very, very important. So being a pathologist, it is no more a paraclinical subject. So we go for every histopathology specimen, we go to the ward, we will examine the patient, we will refer the entire case sheet, we will get all the clinical details, then we sit and we make the slide diagnosis, then we apply the CAP guidelines and we give a detailed report. These days, one oncology report, oncopathology report will have minimum 10 pages. So that depth we have to have. So you have to see the patients also, get the entire clinical data. And hematology, you should have the expertise to draw a blood sample. You should have the expertise to do a bone marrow aspiration. You have to do the bone marrow biopsy. Similarly, cytopathology, you should have a expertise to do a blind FNAC, guided FNAC, guided CT you have to do. And in histopathology, whenever we receive the specimen, you have to do the gross the specimen and autopsy. Remember, only medico-legal cases, the forensic people will do the autopsy. All the hospital deaths, it is a pathologist who does the autopsy. So you have to have expertise in doing an autopsy and much more. So the pathology resident should have varied exposure in all the domains when they want to take up pathology.
Thank you, ma'am. I think this one point makes the students to feel that it is equivalent to a clinical branch, because most of them who are considering to take a pathology, they will be having hesitation with one point that it is a paraclinical as called previously. But now, as you emphasize this, it is a clinical branch. And I guess this should get imparted in the minds of the students, those who are willing to take but hesitant because of the societal considerations. Thank you, ma'am. So this one thing is, how is the work-life balance per se when compared to the other clinical department? Because we know that general medicine or general surgery is very hectic branches per se. Though it depends on the institutions, it is generalized to say that it is a very hectic branch. So as far as pathology is concerned, as you have experience with the postgraduate teaching, how will be the life of a postgraduate with respect to a work-life balance?
See, if you feel, that I told you in the beginning, that was my perception when I joined pathology. I felt I can have a perfect work-life balance. Unfortunately, the answer is clear no. If you want to have a work-life balance as a postgraduate, pathology will be a very big no, because equal to the clinical specialty. See, I still remember even in my days, my surgery co-PG will finish her ward rounds and she used to wait for me. I'll be running to the medicine ward, pediatrics ward, surgery ward to collect all the clinical data. So definitely, that's what I say. A pathology resident, if they want to be really successful, they need to work minimum 12 hours a day. They have to be really living in the pathology department and in the wards and OPDs. Then only they can. So if you feel like, no, it is not. I remember PGs in a reputed institution in India. So their day, to my utter shock, I would say, their day starts in the morning at 4 a.m. I'm talking about a very renowned institution in Tamil Nadu. It starts in the morning 4 a.m., night 10 p.m. only it gets over. So the caseload is very hectic, and you have to work minimum 12 hours a day as a pathology postgraduate. No doubts on that.
Thank you, ma'am. I think this will be like answering most of them. If at all they are taking this branch, it's the coolest branch. that answer is very apt for them, because they can just decide it today itself. And so, ma'am, as you know that most of them have one aspect, that either they can work in a lab or they have to attach to an institution. So these are only two options available as far as the perspective of a students, those who are taking the post graduation. So what are the various career path ahead after completing a MD pathology, ma'am?
Okay. So one, as said, as per the general thing, yeah, in the lab, generally pathologists or the lab directors. So you can go as a consultant pathologist and you can be a lab director, you can be the head of the laboratory. So that is one choice. Second choice, as popularly seen and noticed, yes, I mean, you can be attached to a medical institution where you can do diagnostics, parallelly you can do teaching as well. And pathology teaching is not only restricted to MBBS and postgraduates, it is also for AHS students, nursing, paramedics. So you can decide to choose these two. Other than that, suppose, especially in the era of molecular diagnostics, especially we are in the era of proteomics, genomics, targeted therapy, immunotherapy, especially there is a division called theranostics. So theranostics is specific targeted therapy in cancer. So when you want to do tailor-made therapies, proteomics and genomics are the order of the day. So molecular pathology wing is establishing at a very rampant phase. And you can go to those specialized laboratories and you can work where the scope is very wide as a molecular pathologist. Another very important thing in India, dialysis, renal failures. So renal pathology is a very, very interesting discipline, because in our country, getting a renal donor is very, very difficult. So when you get a donor, it is very, very important that the graft should survive. So it all depends on the pathology report. When you do a MHC typing, a HLA typing, when you do a major histocompatibility complex and do a HLA typing, and when you see the rejection rate, all those things. So renal pathology is a very interesting option. Similarly, there is a specific specialty called neuropathology. So where exclusively you can take up. So that is there. And cytopathology. Cytopathology alone is a very, very interesting discipline. And hematology. So hematology, there are two types. One is diagnostic hematology, clinical hematology. See, there are only three disciplines who can take up clinical hematology in India as of now. One is MD General Medicine, MD Pediatrics, MD Pathology. So if you have these three degrees, you can apply for a clinical hematology. There are many institutions like Tata Memorial where they have a diagnostic hematology DMS available. So that is another choice as well. And coming to the research, especially with immunohistochemistry, flow cytometry and all, there are a lot of PhD scholars who really, a pathologist basically act like a bridge between the clinical specialties and this PhD scholars. So you can exclusively go into research and you can support. So these are all the wide variety of options available for a pathologist.
Thank you, ma'am. Now, as you have emphasized about the different subspecialties available under the pathology, now the question arises in the minds of the people as same thing applies to general medicine as well. Is super specialization required to sustain?
Actually, I would feel that this is a very hypothetical question. Because, see, this is for any specialty you take up. Any specialty, that is how it is. Actually, in India, I would say, maybe this is my observation. Maybe if you see after 2-3 decades, the most demanded field would be the family medicine. See, the basic approach remains the same. There are a lot of people in family practice, in a general practice, who really excel very well. Similarly, there are a lot of super specialists who excel in their own thing. So in a country like India, you take up any specialty, when you have 100% confidence in you, when you feel that I have learned the subject well and I am the master of my subject, irrespective of anything, I feel be it post-graduation or a super specialty or even with the undergraduate degree, definitely you will be able to do a very good job. And be it a super specialist degree or EAI or Nothing can take any specialty for that matter. That includes for pathology as well.
Thank you, ma'am. As you have emphasized on AI, just one more add-on question. As you know that now most of the radiologists, if we see once the radiology, even now radiology is considered as a topper's choice. But still, as the days progress, as we move on to see various conferences, various faculties per se, most of them fear about this AI encroaching the radiology. Now, what's your perspective about the pathology, ma'am? Because after a 20 or 30 years is where a student now joining a pathology as their residency will be at your stage now. So, how will be the career aspects after the evolving or encroaching of AI, I can call it?
See, technology will be there. Okay. So, I mean, there are days since you emphasized radiology as a #1 branch. If you take the data, 90s and maybe 80s and 90s, when you compare the rank of people who are taking radiology, so it will be after 2000 rank. Then radiology took a very big step, and radiology is the leading. And it is my perception that maybe after a decade, pathology will be the #1 because it is so much of things are coming up and everything is based upon the diagnosis. Without a diagnosis, if the surgeon, without a exact clear-cut diagnosis, okay, without a true-cut biopsy, if a surgeon does any surgery, it is definitely prone to a lot of litigation. So that is the era which we are dealing with because insurance companies are taking up fully, and we are slowly moving towards a Western system of hospitals and all those things where insurance will be the norm. Without insurance, it is very difficult. So as we move towards it, diagnostic departments will be the most sought departments across. Okay, and coming to technology, initially also when computer was invented, that's what people thought. So what will be the role of us like that and all? Similarly, AI as well. So be it. Let AI do the basic screening and give it to me. Let me do the advanced things. Okay, so if you are equipping yourself for the future, definitely the future will be ours. So whatever AI comes, ultimately everything will depend on human being only. So AI cannot take up anything. It cannot replace a clinical experience and expertise of a doctor. So that holds good for any specialty. So let AI, see, to me, I would say let AI do a routine peripheral smear. Let AI diagnose the basic anemias. Let it tell me whether it is a microcytic or a macrocytic or a normochromic anemia. So let me deal the complicated issues. So let me spend my quality of time on the complicated issues. So, as we speak more about work-life balance. So previously and all, people never even thought of it. People felt for a doctor means they have to work very hard. They have to see till the last patient and all that. So now that there is so much emphasis on work-life balance, so we will use AI in a positive note and let us have a proper work-life balance. Let us also enjoy the life. So what is there? AI cannot replace a human intellect at any cost.
Thank you, ma'am. That was wonderfully and a positive note for the people, those who are aiming to take be it a radiology or be it a pathology, and well emphasized about the pathologies need that may be arised or that will be arised in the future. And now, as you know that you have been mentoring thousands of students so far in your career, and you will also would definitely know people who have been settled in abroad after completing their pathology. So how is the scope and how is the perspective of pathologists after completing a residency in pathology, entering into the foreign countries, settling there, or what are the pathways for that?
See, for a pathologist, the career in abroad is very, very bright. If you want to settle in abroad, I would definitely say take up pathology, especially in Gulf, Egypt. There is a very huge demand for pathologists. The package is really, really huge, and they'll give you all the comforts, and you will be happily settled over there. So if you want to settle abroad, definitely take up pathology, be it US or UK, anywhere. It is very easy, and with our in India, when you're learning pathology, we have the exposure for a wide clinical data actually. For example, papillary carcinoma of thyroid, as a pathology resident, we see minimum 3-4 cases per day. It won't take a minute for us. So we are privileged to see lots of cases. So we have more expertise over others, and especially when for FRC path and all, Indian pathologists clear it with ease, without any coaching or anything. Just like that, after MD, if they are appearing, it is very easy to clear, because our residency program in India is curated in such a way that if you learn in India, definitely you can succeed anywhere in the world. Similarly, the infection load, the number of leprosy, histopathology we see, tuberculosis daily we will be reporting. So those exposure is not available in the Western countries. So if you're planning to go abroad, definitely pathology is a very interesting career option, and you get paid very well. Definitely you can take up.
Thank you, ma'am. As now we have gone through the residency period, post-residency, what are the scopes? One thing I wanted to ask you is, what are the common misconceptions? You would have seen lots of students trained under you too in the post-graduation. What are the common misconceptions they have while joining post-graduation in the pathology? And what are the, like, how you can, you will be doing their questions too. So what are the things that you need to make sure they know before they enter into the residency?
Yeah, as I said previously, even I had the misconception. I told you, when I joined, I felt I can just relax because it is a paraclinical discipline. So first thing is, as a pathology resident, you have to work very hard, and you will be dealing with a lot of biological specimens. So you shouldn't be hesitating for that. We'll be literally living in the tub of formalin. So we have to be ready for that. And all the hospital autopsies we have to be doing. And most of the reputed institutions in India, because we'll be doing hospital autopsies, only medico-legal autopsies will be done in the daytime. Hospital autopsies will happen 24/7. So there are night duties for pathologists. And especially holidays are very limited because the diagnostic departments run 24/7. So you will have definitely duties in pathology. So you should be prepared for that. And you have to definitely spend 12 hours a day in the department itself if you really want to learn pathology. And overall, there are a lot of textbooks you have to study in depth. Because, like every department, right? For a gynecologist means we have to read the entire FGT. Then only you can report female genital tract slides. So you have to read all the things. Bone, you have to read. So ortho, any department, all the clinical specialties you have to read. So I would always say there are 3 postgraduates who will be having big bound books and reading all the time. One is radiology, other is dermatology, the third is pathology. So you should be prepared to read a lot because there are so many books. I always, on a funny note, tell my PG people that when you see those many books to be completed, I say, pathology is long, life is short. So that is how it is. So you should be prepared to read, and work very hard. Then only you can do well in pathology.
Thank you, ma'am. Lastly, I wanted to ask you this one question. If you go back in the time, what advice will you give to yourself as a younger person while you are entering your pathology residency? Like what mistake you probably would have done? You would have this memory per se in your college while you are a resident. You would have made that one mistake, or you would have seen students making that mistake. That one mistake, what you think the people, those who are watching this video, should avoid while they enter the residency?
I don't know, Raghu. I'm unable to answer because when I feel I did my post-graduation from Government Coimbatore Medical College, where I had the privilege. When I did my pathology, it really used to be like a Gurukul. So where, all our faculties will leave at 4 o'clock in the evening, and evening 4 to 5, we used to go to the canteen, all the PGs together. Every batch had 4 PGs. So we were 12 PGs together, and all of us daily, we will go to the canteen at 4 o'clock. So the seniors used to get us all the snacks, coffee, tea and all. When we were in final year, we used to treat our juniors that way only. So till 5 o'clock, we used to really enjoy in the canteen. 5 o'clock, all of us will come back, and till 8 o'clock, not even a single person will move from the chair. We'll be circulating the slides. We will be discussing. So I feel those were our, in our learning curve, I would see whatever pathologist I am today, I am definitely confident when I give a report. At least as a pathologist, in your 3 years, you will learn on how to report a slide. Rest of your career, you will learn what not to report. Okay, what mistake you have to avoid when you, write the report. Okay, so that confidence I have as a pathologist from day one. So that is because of my department. So I had the best education, and we worked as a team, and we really excelled well. And overall in the university also, all the toppers were from Coimbatore Medical College, and we all 4 of us topped across Tamil Nadu. So I don't know, it is very difficult for me to answer this particular question. But they have to, as a pathology resident, you have to really work very hard. So that I would definitely say.
Thank you, ma'am. I think from this 45 minutes session, what I could personally understand is pathology is not the thing that usually second years think of and take, but it is very important. And as you told, it is going to rule per se, as it is not just in a one stream, but every stream depends on pathology for their ultimate conclusion. So I think all the students, all the NEET PG aspirants, all the people those who are waiting for their counseling, best wishes from our team, and those who are taking pathology, no doubt, it as we have listened from ma'am, this pathology subject is no more a paraclinical. It is no more less or inferior to any clinical branch. And one thing I just wondered after ma'am told is the 3 subjects which we always feel that we will be having a good work-life balance, we will have a very short thing to read, is going to be a one which is going to be entirely different from our understanding, be it radiology, be it dermatology or pathology. They are going to be voluminous, as ma'am told. So instead of having that kind of just a simple understanding, taking it granted that this residency period is going to be a fun-filled, but pathology is not so. So all the very best. So pathology is going to be excellent field in future, without doubts, if you are interested. So the ultimate key is with you. If you are interested, you can take. One with a small thing which I wanted to end this session is I myself have a personal experience of a person who had taken clinical laboratory in AIMS, near AIMS, and he has left because the clinical essence was not there. This was the thing which he told me personally when I asked him why he left and came. But after listening to this session, I think at least I can personally feel that no more clinical essence absence will be there in any diagnostics subjects. They definitely, if you have interest, you can go to the wards, you can listen to the patients, and finally conclude. It all depends upon individual's interest, be it in any field. So far we have completed around 4 to 5 streams, and I definitely can assure you that before your counseling, probably we still don't know the dates, but before that we will try to complete all the subjects for you guys, so that you can have a better understanding and you can go for your residency. Thank you, ma'am. Thank you so much for joining with us today. This session was very special to us for answering all the questions, and I thank all the students, those who are commenting in the chat box, that this session is fantastic. We will try to keep up your expectation from us through different sessions in the future. I thank Dr. Parthiban for arranging this session. I thank ma'am once again. We will meet you back in a wonderful session in the upcoming days.
Thank you.
Thank you, ma'am. Stream close panta.